time to take a coding break. Hello, 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 and welcome back to the Coding Break podcast. I am your Coding Break medical coding coach, Tam Talk, here to talk about everything, the good, the bad, as well as the ugly as it relates to the medical coding industry. So what shall we talk about today? So there are a myriad of things that we can discuss, but I think I want to tap on the subject of the big beautiful. And what I mean by the big beautiful bill, also known as the big Medicaid cut, the big Medicaid chopper, right? So to be honest with you, I haven't done a lot of deep dive and research on this bill yet. And again, as it relates to Medicaid and also how it relates to the medical coding industry, I'm sure it will have some influence or impact on our roles. What that impact influence will look like, I'm unsure. I can say there'll probably be some tightening of the reins as it relates to finances, but that's not just with medical coding. That's just with healthcare and just as a general population overall, that it will have some type of impact on in that perspective. But yeah, so like I said, I haven't really done a deep dive on the bill just to kind of pull out any things that I could share with you all as it relates to this bill and how it will affect the healthcare industry. It's going to affect the healthcare industry, no doubt. But I did want to come on and just kind of share some possible practical solutions, not so much on a big organization or healthcare organizational level, but as an individual, as a consumer, things that we can do to kind of offset or to help offset the cost or the expense of healthcare. Now, of course, healthcare costs will vary depending on the location and the provider and the organization in which you seek treatment, healthcare treatment. But one of the things that I recommend, again, this is just a practical tip that I would recommend. You don't have to do it, but I want to offer it up, offer some form of solution to the situation. This, to me, I feel like can be implemented by someone on a low or lower income scale, middle class, and probably the higher class, whatever. So you have to create your own health plan. There you go. Yeah, you have to create or start your own healthcare plan. And what I mean by that, like, you don't have to be like Blue Cross Blue Shield or United Healthcare or all these big brands. I'm saying, but you have to treat your finances like an health savings account, or you have to be your own health savings accountant, as well as your own insurance plan. And what I mean by that is, like, if you're on a budget and you budget for like groceries and you budget for other bills, you have to create a little budget for healthcare costs, right? And what I mean by that is you can take as little as $10, probably as little as $5, and you start putting it to the side for healthcare expenses. For those of you who don't work in healthcare, or at least you don't work on the business side of healthcare, I'm not sure if you know that self-pay fees are a lot less than insurance rate fees. So let's say, for example, you may pay $400, or it may cost you $400 for a health encounter. And again, this is just an example. This is not like that's not everybody. You may pay like $400, and because you have Blue Cross Blue Shield, right? But then if you're self-pay, it may be like $300 or $250 or something along that line. It's cheaper. What I'm saying is self-pay costs are cheaper than insurance costs. And the reason for that is because when the contracts are negotiated with the insurances, the different insurances, there has to be I don't want to say a middle ground because that's not the right term, but the fees or the hospital, the healthcare fees or charges have to be able to coincide or be in alignment with the contract that is negotiated for to do business with that particular healthcare plan. So you want to make sure you're getting the healthcare organization want to make sure they're getting the optimum reimbursement for the services, as well as again whatever negotiations are with the contract with that particular healthcare brand. So I'm saying to you that you may want to start creating your own little individual healthcare plan, and that means just like budgeting money to the side. And just like you're budgeting money to take a trip, you're saving money, you're saving for some large purchase or whatever the case may be, you may have to start creating a little bundle of joy or savings for your healthcare expenses. I'm not sure how often you go to your healthcare provider. I would say maybe at least 2 to 3 times minimum or maximum. And of course, you have to go to the hospital, right? You have to go to the hospital, and I would say for emergencies or what have you. So again, I would say you have to start creating your own health plan. Again, if it's like $5, $10, $20, and if you can do more, do more. Start putting that aside. I would say each pay period or at least by the month, and that is strictly for healthcare expenses. So when you go to your doctor's appointment, or you have to get prescriptions or what have you, you can just easily pull out that card and utilize that card for your healthcare services. So again, keep it separate from your other finances, such as you have to pay your mortgage, your rent, you have to pay for groceries and things like that. Make it a habit, make it a point to start putting money to the side. And you can also call your doctor's office and find out, kind of get an estimate of how much those services cost, like an evaluation and management service. How much does that service actually cost, right? And then you can kind of gauge how much money you need to save. And for those of you who may have lost their job, or they don't have the bandwidth to expand their budget for their own savings, healthcare savings, then you need to really have that conversation with your healthcare provider, the office, the billing department, even the hospital, because there are people who donate money to the hospitals or to the healthcare organizations to help those who aren't able to pay for their medical services. The charities and the donations and the organizations, they have funds set aside or donated to those healthcare organizations for reasons such as these, to help cover your self-pay. And the reason why I know this, one, because I work in healthcare, but also as a consumer, I would say a little over a year ago, I did have an emergency, or I was admitted to the hospital. And at that time, we were converting to our new insurance, and I did not have my new insurance card with me at that time. And, prior to being discharged, I was, asked, it was recommended, hey, we do have a charity to help offset the medical costs that you incurred while you were here for your stay. But I kept insisting I do have coverage, and I did, and I do have coverage. So I say all that to say that there are services there to help you with your bills. And again, this was at the hospital. And again, I can't speak to what exactly those are, because each hospital is different. Each healthcare organization is different. But there are people who do, the philanthropists, they may leave, some of their funds to the hospitals or healthcare organizations to help offset the medical bills of those individuals who encounter that particular hospital or organization. So I say that, again, these are all my practical solutions. They're not in writing. They're not required. It's just recommendations that I would wanted to share with you as a consumer that may offset that. But again, like I said, we are all going to have or be impacted by these cuts. I haven't done any deep diving as relates to how it's going to impact us as medical coding professionals. I do know we're just going to code until we hear further information. We're going to code accordingly. And again, I can't speak again specifically to that because each healthcare organization is different, each state is different, each location is different, and each contract that was negotiated is different. So I can't speak to those terms as well, neither. Excuse me. But I want to say that they will be impacted. Another thing that I want to talk about, and so take the focus off the big bill, is again questions about medical coding and what can we do to stretch our medical coding certification. It seemed like I am on constant repeat or replay when I talk about maximizing your certification. Don't be afraid to step out and maximize on your certification. So right now, that we're into a lot of content creation, people losing their jobs. Again, you may have a different perspective on how certain things are to be coded. It's okay to share your voice, right? It's okay to share your thoughts, your process, and you may find that you enjoy, content creation. You may find that you enjoy editing. You may find that you enjoy creating videos, what have you, to get your message across to individuals. I've witnessed plenty of medical coders on several platforms, sharing their knowledge, sharing their expertise, sharing practical tips as it relates to medical coding. And again, this is their journey. I'm not saying that they're right or wrong because, that's their perspective. Just like no one tells me that I'm right or wrong. This is just my journey, my perspective on what I've learned and my take on the medical coding industry. So again, I encourage each of you to start sharing your content, start getting your feet wet, start becoming comfortable with being uncomfortable. We all have to start somewhere. So that way, in the event, and I'm not saying that this will happen, but in the event something does happen to where, whether it's an AI takeover, AI takeover, because you can use AI to help you with your content as well. So go ahead and maximize your certification. If you want to write a blog about it, if you don't feel like, making videos, you can write a blog. You could be like me and do a podcast. So there's so many things you can do to share your knowledge and your wisdom, as well as your tips on the medical coding industry. So that's all that I have for this coding break. But again, I wanted to share with you, my thoughts, because I did receive questions on what my feedback on my thoughts were on the Medicaid cut. Again, I haven't done any research, but these are just my thoughts and my quick practical solutions on how we can maneuver through this as consumers. So that's all that I have for today. And as always, remember to take your coding break. So until next time, toodles.